everyone. This is Sarah Asis, the Health Promotion and Communications Specialist from the Nashua Division of Public Health and Community Services. Welcome to Public Health Week 2026. I am so happy to have you here with us today. We are ready to kick it off and get going. So this year's theme is Ready, Set, Action, and it really emphasizes that everyone has the ability to help contribute to the health of their community and take health into their own hands. Everyone has the option and ability to impact health with your action. All you have to do is start. So I really hope you enjoyed this year's Public Health Week kickoff. We have some amazing vendors here today, some great local community members, and just so much support. So we're so happy to have you here with us, and let's get right into it.
Thank you for being here this afternoon for our Public Health Kickoff. And we're celebrating all of you because you are our public health partners. We make up the public health system together. All of our friends, community, business partners, social service partners, our hospitals. Hello, everyone. Woohoo! I'm Bobby Bagley, and I am the Chief Public Health Official and the Director for the City of Nashua's Health Department. And this is our Public Health Kickoff. It's actually our 15th event, and we're very excited about that. Yeah, keep clapping and keep moving so we can stay warm. Woohoo! All right, you can tell we like to have a good time. All right, so for this Public Health Week kickoff, we are going to have a walk with the mayor. We've got our local community organizations. We have some giveaways, a raffle, and some live music. Woohoo! And I am going to actually turn this over to our person who spearheaded this whole thing, got everything all organized for us, got you all here. Yes, she got the music. Yes, this is Sarah Asis. She is our Health Promotion and Communication Specialist, and she's gonna.
You got the title.
I've been calling her everything except that. Anyway, so she is going to kick this event off for us, and so I'm going to turn it over to Sarah. And then you want to just welcome all around.
All right. Oh, hello, everyone. Thank you so much for being here. My name is Sarah Asis. I am the Health Promotion and Communication Specialist at the Nashua Division of Public Health and Community Services. This year's Public Health Week theme is Ready, Set, Action, and I am so happy to have all of you here with us. This really just shows, how much everyone cares about our community's health and that you're ready to take action and have already taken action, so many of you, to help protect our communities and to uphold health within the greater Nashua Public Health region. I'm just so appreciative to have everyone here. Thank you so much. Thank you. So I'm actually going to go ahead and turn this over to Mayor Donchis to give a few words on Public Health Week.
Well, thank you all for coming. Our Public Health Department, as you probably know, does a fantastic job just across the board. We have public health nurses, some of whom are here. Bobby Bagley here is the director of the whole division. And they're dealing with so many public health issues that are just across the board, and I just can't say enough about what a fantastic job they're doing. But we really appreciate all of you coming today, helping us celebrate Public Health Week, which begins today. And we really need you here in the community. We have, and I know each of you, each organization does so much in your area of expertise. It's just, we wouldn't be the same city, the same community without you. So we really appreciate it. And it's nice to see you today. Now after this, we're going to do a walk. So hopefully as many of you as possible can walk with us on the riverfront, which will take, 15 or 20 minutes. It's a really great walk, and we've finished most of it. You'll see a little bit left to go, but you'll see the great views of the Nashua River. Now we have Congresswoman Goodlander here. We really appreciate her coming. And maybe I will just have her come up because I think she's going to say a few words. So she's working very hard from the city right now. We just talked this morning about some congressionally designated spending, we call it, to help us establish a homeless resource center and possibly overnight stay place. So we thank the Congresswoman for helping us get funds for that project. Anyway, so I'm going to give you Maggie Goodlander.
Thank you, Mr. Mayor. Good morning. Listen, the people of this city, and this is the city, my home city, where I'm born and raised. I learned to read just right behind us here at the library. And I'm just so grateful to each and every one of you for stepping up for this city, for our state, for our country right now. Public health, I don't think you've ever faced more challenges than you faced in the last year. I've talked to a couple of you today and asked, have you seen a year as challenging as the last year? We are so lucky to have Bobby Bagley at the helm here in Nashua. Let's give it up for Bobby. I would go anywhere with you. She could lead me literally anywhere because she's extraordinary. She led this city through a global pandemic and through, I think, the last year, no more uncertainty. Have you ever faced this kind of level of uncertainty? And a lot of this is coming from the federal level, as you all know well. Random, arbitrary decisions to cut off funding, the biggest cuts to healthcare in American history. We've got a lot of work to do to rebuild public health and healthcare in this country. We're the richest country in the history of the world. Every American, I believe this, should get the healthcare they need, when they need it, and where they need it. And thank you. And that is my deep belief, and I know you believe it too. This library, I was in Bobby's office a couple months ago, and she's got a beautiful, it looks like a work of art, and it really is, because it's a public health org chart. And it really understands public health to include community spaces and places like this library, and the work that each and every one of you are doing to meet people where they are. We just couldn't ask for a greater service to our state and to one another. So I know it's very chilly. I'm going to hand the microphone back, but just want to say from the bottom of my heart, thank you for being a part of this important launch. Let's make every week Public Health Week, and God bless you all and stay in touch.
All right. Thank you so much, everyone. Thank you, Congresswoman Maggie Goodlander. Thank you so much, Mayor Jim Donchis. So we're going to go ahead and take a few moments to recognize some of the amazing work that our partners have done. We have a Public Health Champion Award, and this is just really to recognize public health excellence within our community, and thank everyone for their very hard work. everyone. Thank you so much for being here for the awards. Now we are going to kick off our Walk with the Mayor. It's your time to shine.
Congresswoman Maggie Goodlander here. I'm so thrilled to be here at the Nashua Public Library as we launch this important Public Health Week here in the city of Nashua. This is where I learned how to read. I'm sure many of you learned how to read here at this library too. And it may not seem like a hub for public health at first, but the fact is this library and each and every one of the incredible public health providers here are part of our absolutely critical public health system in Nashua and in towns across New Hampshire. I'm so proud to be supporting our public health providers this week in Congress. You know, I'm working really hard to protect your health care and lower your costs because right now, cost is the ultimate barrier to public health, and it just shouldn't be this way. We're the richest country in the history of the world. Every person in this city, every person in our state, every American should get the health care they need, when they need it, and where they need it. And I'm so proud to be supporting these providers here today because they're genuinely meeting our community, meeting people where they are. And I see St. Joe's Public Mobile Health Clinic. I was born at St. Joe's, and that clinic I know is traveling to neighborhoods across Nashua and really changing lives and saving lives. So there's no more important work.
Hi everyone, my name is Luis. I work for the City of Nashua Health Department. I've been working for the city my last 20 years and I cannot tell you how much I enjoy being here because everything that we do is to help the community at all. So basically today we are celebrating our National Public Health Week. It's going to be from the 6th to the 12th of April, and I will recommend you strongly that check the city website. We do have a lot of information and a lot of events taking place in different agencies in the city. Today is the kickoff, Walk with the Mayor. So the mayor is going to be joining us pretty soon, and he's going to lead a walk. So, and then we got a lot of agencies here also telling us what we do in the community and the services that we provide. Ourselves, you know, working for the city, I can tell you that we do have a lot of promotion for staying healthy, like eating properly, you know, washing your hands, and we do recommend a lot of prevention in most of the things that we do. Like we do have two different clinics that we run. We do have the immunization clinic where anybody that lives in the city can come and get vaccinations. It doesn't matter the age. It could be children joining school and adults. You know, we do have certain vaccines as adults we need to have, so we offer them for anybody in the city. Also, we do have a sexual transmitted disease clinic where we invite people to come and get tested. You know, the main idea is to stay healthy, and a lot of prevention, you know. So information is a lot of times our first way of facing any illness. So thank you.
Hi, I'm Joe Chinisi, care coordinator with FCP Live-In. How's everyone today? What we do is live-in caregiving service, so it's one caregiver that lives in the home, provides peace of mind for families who might have loved ones that need assistance with activities of daily living. I'm here for Nashua Public Health Week to spread the message that options exist when it comes to elder care.
Hi, my name is Lady Baxley. I am with Greater Nashua Mental Health on this lovely cold day today. And we are an organization that serves mental health and substance use disorders for individuals of all ages. We have been around since 1920, and we have a couple of things coming up as well as at our organization, one of them being our Thrive Stride 5K event, which is happening on May 16th. And that is open to all individuals in the community, but it's mainly to raise awareness around mental health. Welcome. And I have Lourdes Reyes here as part of my team. Do you want to say?
Wow. Happy to be here and come and see us at our table.
Hi, my name is Gabrielle Amorosa, last name Amarosa, and this is Shamra Simpson, Simpson, and we're with the New Hampshire chapter of the American Foundation for Suicide Prevention. So we focus on suicide prevention through a public health lens, so we're focused on prevention education, post-prevention education, as well as supporting lost survivors, and we do that through a variety of actions, including advocacy and public policy, events and support groups for lost survivors. We do a variety of educational presentations to the general public as well as to educators and other audiences. And we also do fundraising, which both funds programs here in New Hampshire and also funds research into suicide prevention and protective measures with researchers at various institutions working on that issue. And we're happy to be here today supporting public health in Nashua and celebrating Public Health Week. So we don't have a physical office in New Hampshire. We operate all throughout the state. And so if anyone is interested in getting involved with us, they can reach out via our website. And we have a variety of ways to get involved, both online through Zoom meetings or meeting for a variety of our in-person events throughout the state.
Hi, my name is Mike Jobin. I'm the sales manager for Minuteman Medical. We are a family-owned, family-run company in Manchester. We have been established since 1998, so we've been providing services for 28 years throughout the state of New Hampshire. We provide disposable medical supplies for individuals living with chronic conditions, facing financial challenges, or age-related challenges. We offer direct insurance billing, free home delivery, and we provide services all over the state for residents of New Hampshire. Thank you very much.
Hi, I'm Tina, community health worker at Lamprey Healthcare.
Hi, I'm Maddie, one of the other community health workers with Lamprey.
And I'm Amy, also a community health worker at Lamprey.
So Lamprey Healthcare is a federally qualified health center. So we have our location in Nashua, in Newmarket, and in Raymond, New Hampshire. Our Nashua location's located right over on Prospect Street at 22 Prospect on the corner of Harbor and Prospect. And what we do is we are general primary care for everyone from 0 to 100. We offer general adult services, pediatrics, as well as OBGYN, prenatal. We offer behavioral health services, as well as an MAT program. So the services we offer are very wraparound, and if there's referrals needed, we definitely refer out to local area hospitals and other centers that we work closely with. And it was great for the city to invite us to this event. We're happy to be here. I think this is at least our 4th year in a row here. We're just happy to meet everyone, get to know other resources, and just be here for the community.
So, good morning, everybody. I'm Donna Masso. I represent the Nashua Regional Planning Commission as well as the Regional Coordination Council 7 for the Community Transportation Group. And what I do is I try to help people get transportation. So there's a lot of rides that people need, mostly to medical appointments that I try to help fill. And I do that with the Community Rides Program, which is some taxi service as well as some wheelchair rides. So it's really all about transportation and all about finding it. And part of the transportation piece is the Gate City Bike Co-op, which is happening on May 2nd. And so hopefully everybody will try to get out for that, and that's through the Gate City Bike Co-op. But I'm at Donna Masso, 603-417-6571, and please call me if you need some transportation help, and I'll give you that number again. It's Donna Masso. It's 603-417-6571. And thank you, everybody, and thank you especially to the City of Nashua Community Television Organization. So thanks.
Good evening. My name is Josh Castro. I'm a community health worker with the Division of Public Health in the city of Nashua. But today here I'm tabling for Fatherhood Group, which we run in collaboration with United Way and Arlington Street Community Center. We run about once a month, the second Tuesday of every month, and we aim to provide a safe space for fathers to talk about the reality of being a parent. You know, we feel like fathers are often overlooked in the community, and we want to be able to provide a safe space for them to learn and grow without feeling judged and break down the stereotypes. So feel free to come join us and reach out to me at Nashua Public Health as well.
Hi, my name is Nick Schellberg. I'm the communications specialist for the Nashua Transit System. I'm here representing my agency at Public Health Week. Transportation is a vital resource for the Nashua community, both for your personal health as long with community and economic health. We help get you to where you need to go, and yeah, we hope that you take a ride with us on the NTS City Bus.
Hi, my name is Terry. I work for the Doorways of Greater Nashua. We help navigate substance use treatment for people. We'll educate on Narcan use. We have testing supplies so that people know what they'll be using. They can test it and make sure there's no fentanyl or xylazine in it. We also offer assistance with some funding for housing after getting out of treatment, but you have to get out of treatment to get the funding and participate in our program. We provide resources. If somebody needs something, we'll try to locate it for them and point them in the right direction. What else do we do? We do so much and I can't think of half of it, but we work well with our community partners, with Public Health and Lamprey Healthcare, City of Nashua. People come in, and sometimes it's parents. Parents will come in asking for help for their children, and we try to guide them the best we can. And hopefully they'll come in and with the child, and we can. When I say child, they're usually an adult. But yeah, we substance use, and we do Narcan trainings. So the test strips are here. And then we have over here, we have the Narcan. We will train you on how to use it if necessary. We also go out into the community so that let our face be shown so they get comfortable with us. We just want to see them do better, do well, get healed, and have a productive life once again, and be the person who they really want to be.
Hi everybody, my name is Chris McCarthy. I'm the Public Health Emergency Preparedness Coordinator for the City of Nashua's Division of Public Health and Community Services. I'm here at a table, and what I'm doing is presenting on the importance of emergency preparedness for individuals and their families. I have several types of literature teaching everybody how to create an emergency preparedness plan. We do a step-by-step process, a very comprehensive booklet that we have made over significant amount of time here. We also have a bag that tells people how to create a plan, because having a plan is better to have and not need it, as opposed to needing a plan when you need it and not having it. So if you want to come on down, we're happy to talk about emergency preparedness, the ins and outs, and other than that, it's a great day to be here, and thanks for hearing from me.
Hi, my name is Mary Buteau. I'm the Radon Program Manager with the New Hampshire Department of Health and Human Services Radon Program. I'm here today at the Nashua Public Health Week Kickoff to talk about the resources we have for residents here in Nashua and across the state. Radon is an issue in New Hampshire, where we are the granite state. It can enter homes through cracks in the basement, through soil openings, or if someone's on a private well, maybe through private well water. We offer a program for free testing. This shows you what this looks like. You just go ahead and go on our website, the Radon Program website for DHHS, to order your free test kit there. And the National Public Library also participates in our Radon Monitor Loan Program. You can borrow a monitor from the local library here, and feel free to reach out to me with any questions you have about radon. The primary health concern we're trying to prevent is lung cancer. This exposure over long periods of time can lead to lung cancer, so we hope you test your home for radon today. We can't see it, smell it, or taste it, so the only way to know is to test for it. Thank you so much. Have a great day.
Hi, my name is Hannah Prevost. I am a enrollment specialist and recruiter for Nashua Community College, and we're here at the public health event today here at the Public Library Nashua, promoting some of our programs to help support the local community and our public health efforts here. So just to kind of highlight a little bit about what we're doing, we have a public health informatics pathway that feeds specifically into a bachelor's degree program that's offered through the University of Massachusetts Lowell campus. So students can start with us and get their associate's degree, and then transfer and get their bachelor's degree at a reduced cost. And then once you finish with your bachelor's degree, you go and work in kind of the behind the scenes stuff, collecting data to help better support the public health and make sure that folks are staying happy, healthy, safe here in New England. So that's one of the programs that we offer here at Nashua Community College. We also, of course, have a nursing program for folks that are more interested in working in more patient-focused care and all that good stuff. So we have a 2-year associate degree program that has absolutely exploded over the last couple years, which is great. So that's one of the wonderful programs that we offer. Students can get their associate's degree in nursing, finish up with us, and then same as before, they can transfer to one of the 4-year schools here in New Hampshire and get their bachelor's degree at a much reduced cost. So just a couple of the different programs that we can offer to folks that are interested in going and working more directly in this type of environment. So that's just one of the great things that we offer at Nashua Community College.
Hi, I'm Sonia Prince with Primerica Financial Services in Nashua, New Hampshire, and I am particularly interested in educating the population about their finances. So financial education is a big need. A lot of people struggle with managing their money, so we have some really good classes and books and sessions that we can do together at no cost for people to learn about their finances. So debt, taxes, and insurances, budgeting, you name it. We help people with everything. Come see me if you need me. 603-486-5930. Sonia Prince at Primerica Financial Services. Thank you.
Hi, I'm Ren Bodwin with New Hampshire Department of Environmental Services. I'm here today at Public Health Week to talk about a few things. So we are talking about grease management, anybody on septic systems, how to get those cleaned out, and the first New Hampshire Clean Water Week, which is next week. So we had some nice giveaways for grease scrapers and grease caps. So the last thing that we want people to do is really pour that grease down the drain. We do not want that. We want you to kind of put that on the side in a jar or a can and then throw it in the trash afterwards. If you're on a septic system, we want to make sure that you know it's critical to get that septic system pumped every couple years, again, based on family. And we want to make sure that you know what's flushable, right? There's a lot of things out there, like they call them flushable wipes, that are not flushable. So we do have guides and stuff on our website that really show you what you can flush and what you can't to make sure that the wastewater stream stays safe. And then lastly, we're talking about Clean Water Week. So next week is Clean Water Week in New Hampshire from April 12th to the 18th. This is the first time in our state where wastewater plants throughout the state are going to be open to give tours to anybody that would like them. So if you're curious about what happens with your daily flush, please go and take a tour of your wastewater plant and see the amazing work that these people do every day to make sure that our water stays clean.
Hi, I'm Rosemary Ford, and I'm the director of the St. Joseph Hospital Mobile Health Clinic. Our mobile health clinic serves the greater Nashua area, providing non-urgent walk-in care. So what exactly does that mean? Well, we'll see you if you're not feeling well, if you have a health concern. We provide wound care, we can write prescriptions, we carry an array of vaccinations, anything from shingles to hepatitis, vaccinations, as well as point-of-care testing. So if you're not feeling well and you're wondering, do I have the flu, do I have COVID, do I have strep, we're able to test you right on the spot, as well as pregnancy testing, STI testing, and hepatitis testing. Also, we have blood sugar testing as well, and our licensed nurse practitioners are happy to see you. Essentially, we're a doctor's office on wheels. We're out in the community 4 days a week, and you can follow us on Facebook, the St. Joseph Hospital Mobile Health Clinic. Thank you.
Thank you so much for being here with us for this year's Public Health Week. We had an amazing turnout and so many local vendors to share their resources with the community. While this year's Public Health Week is ending, I really do want to remind you that every day can be Public Health Week. You can take your health into your own hands. You can volunteer in your community to make sure that they are the healthiest that you can be. So get ready, get set, and take action for your health and the health of everyone you love.